back to segment 3 here with Dr. Carolyn Teske on PHAMCAST. We are really diving in and having such a great conversation about eye health and integrative health and prevention at every age and stage. And this segment's not going to be any different. We're going to roll up our sleeves now and really talk about something that's really near and dear to my heart, because hormones impacts all of us at every age and stage of life. But it's having a bit of a moment in the media right now, like hormones weren't always important. But welcome to the party. Hormones really can impact eye health, Dr. Teske. And let's talk about first the connection between eyes and hormones, and then we'll go through the ages and stages of life and how that actually works.
Absolutely. I think, again, in terms of vision, we seem to think, do I need glasses? Do I not? But there is so much more attached to vision and wellness in terms of eyes that it's important to consider hormone imbalance, whether it be stress hormone or sex hormones or all of the above.
Mm-hmm. Exactly. And what can that manifest in vision like? So for example, if somebody has cortisol dysregulation, or they've got estrogen depletion, or whatever the hormone imbalance may be, what does that look like to the patient?
There's many symptoms. Dryness is probably the most common one. Now, often patients will report, well, my eyes feel fine.
Yes.
That doesn't mean they're not dry. Right. And the analogy I usually give to patients, I occasionally get my car detailed. And if you clean the inside window of your car, that is what dry eye looks like before it hurts.
Right.
So you don't really realize how blurry your vision is until we clean up the window or make your eye less dry. But lack of estrogen is probably the most, obvious reason why patients' eyes get dry.
Yes. And you would always say, don't wait until your eyes are dry. What should we be doing every single day?
For sure. So I have been tagged, and I think it's going to be on my tombstone to say, get up, brush your teeth, unrelated to eyes, put some eye drops in there, take some omega-3s, and start your day. Because by the time you feel that your eyes are hurting, it's very much like saying, oh, my lips are dry. Maybe I should have had more water today. So we don't ever want to feel dry eye.
Right.
Can we get this on a T-shirt instead of a tombstone for you first? I think that would be a little bit better.
That's a great idea.
You're going to be around for a long time.
That's the plan.
Yeah.
Now, what about, we're all mothers and we do have daughters, and we're going to talk about men in a little bit, but what about these young women in puberty? Let's talk about that, because I don't think we even think about eye health necessarily when you've got a pubescent teenager that's hormones are everywhere, but we're not thinking about their eyes. Why should we?
Well, we do think about their skin.
Yes.
And their skin, of course, around their eyes is a big contributor to dryness. So there's really two parts to your tear system. Oil that comes from the glands that are along the lids and lashes. So if your skin is not good, then the oil component of your tears will not be good. And the water component. Frequent styes with puberty or, changes in estrogen certainly will contribute to vision fluctuations and or even just vision stuck, at eyes, particularly with devices. We talked about that earlier, but particularly in that puberty age group, they're certainly using more devices than they ever have before.
Yes.
So hydrating your eyes, we blink half as much looking at a device. So even more important for us to follow that rule of get up and brush your teeth and put your drops in.
And speaking of devices, before we move on, what is one of your recommendations actually on the device? Because I loved this tip that you gave many years ago on our eye health series that we did. What can we do to help? Because the blue light in our phones are horrible.
I was literally going to ask about blue light stuff.
Yeah,
for sure.
Yeah. Mm-hmm.
So the 20-20-20 rule is one really important thing. Embrace that we want to use technology, but embrace what technology is doing. So every 20 minutes, blink 20 times, look away 20 feet. And you'll sense that change immediately. If you stop looking at your device, of course, the musculoskeletal system also suffers from looking down at the device. So look up, look away, and I would love to see children under 10 not really even using devices.
Yeah. Wow, that's under 10. That's amazing. I think that's great. That's a great guideline.
Yeah, yeah, and it
That's
is
a
so
tough one.
important. It is a tough one, but I think we need to understand the consequences of our action, because we don't necessarily see it now, but what we do or not do now is going to impact what we do or can't do 10 years from now. And our eyes are no different. And I think we often take them for granted, especially when they're younger. So that's really important. So I love the 20-20-20 rule. Taking a break really makes a difference. And that actually has an impact on the actual muscle in the eye, correct? Like when you talk about stuck eye, what does that mean?
So your focus system, much like the zoom power on your camera,
Yes.
right? So you're hitting the zoom button, hoping that that picture will become clear. So the muscles really contribute, but it's the lens inside your eye that has to relax and or contract. That's what causes you to be able to focus properly. So when your lens is not relaxing and it stays contracted, that's when you're stuck. So that's when it's difficult to be able to look up and see properly because you've been staring up close for too long.
And maybe your child's having trouble at school, learning issues.
Yeah,
And you don't even
absolutely.
realize that this can be part of the issue, right? So then if we move on, pregnancy, we've all been there. What happens when you're pregnant to your eyes, and what's important there?
Well, we know that the cornea can actually change shape. So babies do lots of things to our bodies, of course. But, you know, your vision can change. More astigmatism correction. It may or may not go back. We hope that it does. Headaches, migraines, attached to, high blood pressure with pregnancy. There are so many potential vision problems.
Does
that will
does
come.
blood volume actually do anything to the eyes or no? Because your blood volume does increase during pregnancy. Does that affect the vision at all?
Well, certainly if we're getting into, hypertension and toxemia, definitely you can have
Right.
bleeds. Diabetic, gestational diabetes, very, very common, which potentially could lead to vision loss, really, if it's not treated. So those will be your pregnant patients on insulin who need to have their blood sugars controlled.
Right. And I think sometimes when we're pregnant, there's so much going on, we don't think to go see the eye doctor. When in
Absolutely.
fact, we could prevent stuff from happening that could be catastrophic.
Right.
For
Like
sure.
losing your sight
For sure.
is one of them. And I remember you sharing with me, catching, a cancer in someone's eye long before really anybody else in the medical community had, and fast tracking that for treatment. Like that's got to be some of the best cases that you see.
Yeah, it is probably the most difficult role that I have to play. I've learned through the years to check photos before I walk in the room,
Yeah, I bet.
because you do have to put on a face and be the healthcare provider while swallowing your emotions to path that patient to care.
Right.
But
Exactly.
I've learned that finding tumors is difficult, but not finding tumors
Is worse.
would be worse.
100%. So perimenopause and menopause, we know. So you spoke about estrogen.
Yeah.
Right?
I was just going to say, you're in, I'm peri.
Oh, I'm
So,
I'm
yeah.
I'm postmenopausal.
Yeah.
That ship sailed.
But that's another
years ago.
stage too.
100%, it sure is. And we think, that's a really good point to bring up, because I think people think menopause, once you've stopped menstruation, you're past menopause.
Yep.
I've now been from 39 and now 57, many years without a menstrual cycle. And there are changes. I'm seeing changes in you've caught them. I got to come back and see you because my distance vision is going. Why is that, Dr. Teske?
Again, I think, that your ability to focus. I usually say too many birthdays. That's the saying I like to use rather than age, because I'm never going to be old.
No.
As long as this is still,
Right.
young, then the body may have changes that are from too many birthdays.
Right.
But your ability to focus is less, right? So you're going to start seeing distance plus close vision issues in some cases.
I'd like to ask if there's any connection, and I know I haven't prepped you for this in advance, but there's just as menopause is having a moment, bioidentical hormones. Are you noticing difference in vision? Is it improving? With the use
Absolutely.
of bioidentical hormones? Okay, that's really
100%,
interesting. Yeah.
I think that one study that prevented us from, using hormones to
Right.
help supplement our bodies from what we're deficient in. Now we know that bioidenticals can have a huge role.
Oh my gosh.
For dryness, for
Yeah.
vision fluctuations, all
Right.
of the above.
Yeah,
Right.
and
Oh,
it's
that's
been a game
fantastic.
changer certainly in my life and health. And then we collaboratively, and you know this, Megan, Dr. Teske and Dr. Prowse, Christy Prowse, the Institute for Hormonal Health, did an eye health series and collaborated on that. This is what this preventative health movement is about: is breaking down the silos and having gastroenterologists and optometrists and gynecologists work together, functional medicine people to work together, and what a difference it makes? That's a great question, because that's really, really important. Now, the one we don't want to forget about the guys. What about male hormones, and what about the men in our life?
Yeah, they are equally impacted by an imbalance in hormones, right? The androgens and the, testosterone changes in their body. Not to discount the cortisol levels, right? I see many, sort of 30 to 40-year-old men who are having, serous changes. So cystic-like changes in the retina as a result of cortisol levels that are dysregulated. So yeah, absolutely. This is not gender specific. Vision problems from both men and women, children, seniors, all of us can be impacted.
Well, and we wear stress like a badge in our culture, don't we, in society? Like, we're so stressed, and we just say, oh, we're so stressed, but we really aren't listening to what is the physiological impact it's having on all systems of our body. And men tend to be the ones that have to man up, and they have this tremendous amount of stress in their 30s and 40s and 50s. And eye health is silent until they have an episode. And so, like you're saying, that preventative piece, and sometimes we need that wake-up call, right, where you're giving some news that maybe they didn't expect to hear, because they're not managing their stress properly, and that cortisol dysregulation is impacting blood pressure, or, pre-diabetes. You see diabetes in the eye often before an endocrinologist would.
Yeah, absolutely. In fact, endocrinologists often use eyes as a tool to know whether or not blood sugars are controlled,
right,
and whether or not we need to alter medicine, right?
This is
to
so
establish better
fascinating.
control.
Isn't it?
So fascinating.
It
I
is.
had no clue.
And this is
It's
why
amazing,
we're
yeah.
doing this.
Yep.
And this is why Megan
Yep.
and I love our partnership. Megan is a medical healthcare professional in her own right as a medical sonographer. She's seen a lot in her career. But she's also coming from a real lens of, in this new space of integrative and preventative health. Is not where you've been. You've really been more in conventional medicine most of your career.
I would say yes, definitely.
Right?
Yep.
So it's literally an eye opener
Yes.
for Megan. And this is why I love having these conversations. So you've been really wanting to talk about, and it's so important. It plays a role in all of our health, and it's the same with eyes. Nutrition. Let's talk about eye food. And Megan, you want to ask the question, because everybody thought this as a kid.
Yes,
What do you
that
wanna
carrots are carrots good for your eyes. I'm hoping everybody's munching on some. Maybe that's like a Pavlovian response when you're talking about eyes. Make sure you have your carrots.
Right.
Well, and carrots are important.
Yes.
I usually tease young patients in my exam room chair and ask them, what's the best vegetable you could eat for your eyes? And carrots are often the answer.
It's almost always.
Which I
imagine.
agree.
Yeah.
Carrots are good, but they're not the best.
Right.
So lutein is most predominantly found in your green leafy vegetables. So just like the rest of the body really benefits from green leafy, so do your eyes, to prevent things like macular degeneration. So we need our green leafy. We need our omega-3s.
Yeah.
So that's in your healthy fats, right? So I think we want the colors of the rainbow, right? Just like you want for the rest of your body, that's what you want for your eyes.
Over the break, we heard about blueberries too being
Yes,
very,
blueberries,
very
Of course,
important.
they're
Why?
antioxidants,
Okay.
right? So,
Yep.
and we can talk about other foods, the spinach, the kale, the green leafy, again, really important. But much like you fuel your gut with what you believe is healthy, your eyes need to have the same kind of nutrition. And if you don't have a good gut, which is our second brain, they say, maybe first brain, then we really will see the impact in terms of eye health problems later on.
Absolutely. And nutrition, and to your point with gut health, we're kind of bringing this full circle as we're rounding up our discussion today. Gut health impacts mental health. Absorption really has a massive impact. And we often, take eating well and taking our vitamins, but your gut's not healthy, you're not absorbing any of those nutrients. So I think it's
Exactly.
really, really important. And we're all in, the basis of all disease is inflammation. And most of us are walking around because we live in a toxic culture. The foods we're eating, the stuff we're putting on our skin, there's inflammatory response. One of the things that you also prescribe to or subscribe to and believe in is the impact of lymphatic drainage for the eyes. The lymph system runs alongside the circulatory system. Firsthand as a person, but also as a doctor, an eye doctor. Lymphatics plays a role too, doesn't it, in that gut health, but also puffy eyes. Let's talk about that for a quick minute.
Oh, absolutely. Often, again, people will end up in my chair saying my eyes hurt. And eyes are hurting because the orbit is full of fluid. So as long as the eyes are healthy, and we ruled that out, then lymphatics and sinus congestion, which, again, speaks to toxins that we are breathing in and or swallowing in our world. But our lymphatic system is our drainage system, right, for the toxins. So if we have plugged drainage and or, non-functioning toilet, I think, as some have called it, then nothing works well. So around your eye, the periorbital structures will swell if things are blocked. Again, the patient may not experience sinus congestion, may not realize, but definitely can see. Similarly with periorbital swelling from thyroid disease, right? Again, in that age group, perimenopause, menopause, often a dysregulated thyroid, which is the master gland, will present so many symptoms, including vision fluctuations and dryness and, hyperthyroid, where you actually have an orbit that's pushing forward. So for sure, we need to have a good handle on all the systems in the body in order to be healthy and well.
Well, and that's why we collaborate with Lymphatics Canada, Joanne Rattay, who is an amazing lymphatics specialist here, or massage therapist in lymphatic, trained in lymphatic drainage, and of course our favorite, Dr. Perry, who's taught both of us so much and will be coming on our show, which is amazing, about lymphatics. And I just want to leave with this as well, because you've been so instrumental in helping my mom. I'm going to try not to get tearful. With chronic bladder infections, every doctor, every specialist, my mom's eyes always with a bladder infection, her eyes will get very sore and red and dry, and they're telling her that it's nothing to do with the infection. You're the one person that has validated time and time again that it is connected to the infection and has got a strategy in place to help her. So I just want to say that don't underestimate the power of your eye doctor. And if you want to learn from the best, Dr. Carolyn Teske is the one to turn to. Thank you for a jam-packed hour full of, I always learn when I'm with you. But we're really excited just for all of those listeners out there. Megan, our CEO of your Health Hub, it's right around the corner. We've been in production for a very long time, and Dr. Teske has generously offered her expertise. So she's going to be giving some information along with all kinds of other healthcare professionals to stock your preventative health toolbox. Will you come back?
Absolutely. Thank you so much. Like you, I love learning from each other, but more importantly, I love helping patients.
Yes, and you do that so well.
Thank you.
I don't want this hour to end.
No. Are there any other messages you want to leave for anyone before we end? Or
I think better together, ladies. Better
together. Together. You betcha. That's a perfect
and share.
way to end.
Share with everybody.
Absolutely. Yeah. So if you are a patient, a physician, optometrist, or perhaps you're a change maker in our healthcare system, it's time, long overdue, for change. We all deserve to work better together as one so that people will live longer but live well. Just saying goodbye here from Margaret
and Megan.
And until next time,
and
be well. And Dr. Teske, of course. Until next